In today's Eye on Health, January is Cervical Cancer Month, and we're talking about important information women and the men who love them should know.
Yeah, cervical cancer used to be a leading cause of death for women, but fortunately that is changing. Still, women need to be on guard to protect themselves and also to protect their daughters.
Our guest is Dr. Eriwen Miller, a gynecological oncologist with Allegheny Health Network. Dr. Miller, we are so glad that you're talking about this very important topic. Women's health is so very important.
It certainly is. It's absolutely been my pleasure as part of my career to take care of women and to take care of them here locally in the Pittsburgh area and in the tri-state area.
Let's talk about cervical cancer, because what causes it?
So the very large majority, close to 98-99% of cervical cancers are caused by an infection with the HPV virus or human papillomavirus. Human papillomavirus is very prevalent among sexually active individuals, carried by men, but mostly causes infections in women. So most men are asymptomatic, and women tend to have issues secondary to infection more commonly than men do. Very, very prevalent among sexually active people.
And because of the lack of symptoms and women getting pap smears and other tests, they are more likely to have that diagnosis. There was a huge push for the vaccine. What can you tell us about this? We've seen the commercials now on TV, but a lot of parents still have questions about this because it's very age specific.
Yeah, so, as a mom of two myself, I think the first thing that parents want to know is it safe, right? There are a lot of questions about vaccine safety, and these vaccines have been very extensively studied in very, very large clinical trials. Safety is proven. When reactions happen, they tend to be very mild reactions at the injection site, which is generally in the arm. So there can be pain, there can be swelling, there can be redness. But in terms of significant side effects, very minimal to none. I think the other really important thing to know is that age of administration is really important. These vaccines are most effective for people before they're sexually active. So immunizing our children when they're 11, 12, 13 years old is incredibly important because they have yet in their lifetime to be exposed to HPV.
What about women who are too old to be eligible for the vaccine? What can they do to protect themselves? Is it a matter of screening mostly, or is there something else?
Yeah, well, so I think there's two really important points here. The first is that we're recommending vaccination to children at age 11 and 12. We do recommend catch-up vaccination for anyone between age 13 and 26 if they've not been previously vaccinated. The FDA 2 years ago in 2018 approved vaccination for both men and women up until the age of 45 in select populations. So I think keeping in mind that those that are beyond the 11 to 12 age range can still be eligible for vaccination is important. Beyond the age of 45, it's truly, encouraging patients to keep up with their yearly checkups with their physician, keeping up to date with their pap smears and HPV screening.
Dr. Miller, as an oncologist, you see what can happen.
Mm-hmm. Absolutely. Absolutely. And, we are able to detect on pap smears and HPV screening pre-malignant conditions, pre-cancers. We're able to treat these before they become a cancer. We're able to detect them as earlier cancers. And so really the importance of maintaining that relationship with your gynecologist, keeping up with the pap smears so that we can detect these at a very treatable state.
Great. Thank you so much for all of this really important information, Dr. Miller.
My pleasure. Thanks for having me.
And remember to keep watching our Eye on Health series here on PTL. It happens on Wednesdays, and it's brought to you by Highmark Blue Cross Blue Shield, together with Allegheny Health Network for your health.